Imagine going to the hospital for a simple procedure, only to find yourself drowning in unexpected medical debt. It's a common experience for millions of Americans. But what if I told you that your ability to afford care is shaped by forces you never see? Powerful insurance companies and lobbyists pouring millions into politics. Today, we're uncovering how over $156 million in lobbying and millions more in political contributions have reshaped our healthcare system, who it benefits, and how it harms everyday Americans. What is lobbying? Lobbying happens when companies spend money to influence government officials and policymakers. This can take many forms, including campaign donations, direct meetings with lawmakers, or funding studies that support their positions. The goal is simple: shape policies that benefit their industry, often at the expense of public interest. When it comes to healthcare, this influence affects what treatments are covered, how much patients pay, and who gets access to care. Big question. How do political contributions shape healthcare access? We often think of healthcare decisions as being made by doctors and policymakers, but the real story involves billion-dollar companies shaping policy behind the scenes. Now, let's break down exactly where these political contributions are going. This pie chart tells a clear story. Insurance and HMO companies overwhelmingly favor one side of the political spectrum when it comes to campaign donations. In 2020, a staggering 67% of contributions, over $35 million, went to Republican and conservative groups. Meanwhile, only 33%, around 17.5 million, was directed to Democratic or liberal candidates. And what about nonpartisan groups? They barely registered, less than $2,400 or 0% of total contributions. This lopsided spending tells us something important. Insurance companies are not just donating for access, they're funding policies that protect their profits. By investing primarily in conservative candidates, they're backing policies that limit public health care expansion, resist price regulation, and maintain the dominance of private insurers. Our goal today is to understand how insurance company contributions and lobbying efforts influence which policies get prioritized, and how that directly affects medical debt and access to care. Let's meet the major players. Who's spending the most? Let's start with the biggest players. Between 2019 and 2020, major insurance companies contributed tens of millions to political campaigns, while spending over $156 million on lobbying to influence healthcare policy. Leading the charge are Blue Cross Blue Shield, Cigna Corp, and America's health insurance plans, all of which spent millions to ensure policies benefited business interests. These figures don't even include campaign contributions, funds directly given to candidates and political parties to secure influence in elections. The combination of lobbying and contributions gives these corporations power over which policies pass and which ones die in committee. Let's take a moment to break down the difference between contributions and lobbying. Contributions are political donations to campaigns and candidates. These funds help politicians get elected and often secure influence once they're in office. Lobbying, on the other hand, is money spent directly influencing policy through meetings, research, and pressure on lawmakers. Blue Cross Blue Shield spent 5.8 million in contributions plus 19.4 million in lobbying. Cigna spent 2.1 million in contributions, 7.2 million in lobbying. Aflac spent 2.2 million in contributions and 6.7 million in lobbying. Some companies, like Ryan Specialty Group, spent millions on contributions, but reported $0 in lobbying. Others, like Blue Cross Blue Shield, took a dual approach, spending heavily on both campaigns and lobbying efforts. The takeaway? Contributions buy access to politicians, while lobbying buys influence over the policies they create. In 2020 alone, total healthcare lobbying topped $642 million, spread across key sectors, pharmaceuticals, hospitals, and insurance companies. Nearly 50% of this total, 642 million, came from pharmaceutical companies, followed by hospitals and health services. Their goal? To influence policies on drug pricing, hospital reimbursements, and insurance coverage. The pharmaceutical industry spent $318.9 million. The hospital and nursing homes spent $118 million. And the health services in your HMOs, these are your insurance companies, they spend $109.3 million. With pharmaceutical and insurance companies spending billions lobbying over time, it's no surprise that drug prices remain high and coverage restrictions continue to hurt patients. This brings us to a critical consequence: medical debt. Medical debt has become a crisis in America. The data shows that people earning less than $40,000 a year are hit the hardest, with over 50% carrying medical debt. But it doesn't stop there. Black and Hispanic communities face higher debt rates compared to white households, and women, particularly those without a college degree, are disproportionately affected. So let's recap. 50% of people earning less than $40,000 have medical debt. Black and Hispanic households face higher debt than white households. And women, especially those without a degree, carry more debt than men. This isn't just a personal problem. It is the result of policy decisions shaped by the same lobbyists and contributors who prioritize profit over public health. And AI plays a role here too, particularly when it comes to insurance denials. Did you know that insurance companies are increasingly using AI to automatically process claims and issue denials? Companies like UnitedHealth Group and Cigna use AI systems to scan claims and determine whether they should be approved or denied. This speeds up decision making, but often leads to errors, disproportionately affecting marginalized communities. In 2022, insurers were found using AI to deny claims in seconds, leading to wrongful denials of medically necessary treatment. But there's hope. AI isn't just being used by insurers, it's also helping healthcare providers recover denied claims. Waystar Denials Prevention and Recovery platform use AI to help healthcare providers analyze denial trends, predict risk, and automate appeals to recover lost payments. By automating these processes, hospitals and clinics can recover millions and focus on patient care instead of insurance battles. Healthcare policies aren't written in a vacuum. They're influenced by powerful players with deep pockets. But by staying informed, sharing knowledge, and advocating for change, we can push back. Share this video, subscribe for more insights, and let's work together to make healthcare equitable for everyone.